Hi, my name is Lauren Robinson, and this is my brief presentation on my Capstone project where I created a neural network to analyze macrophage data. So I know this could be a broad audience, so I just wanted to give a quick rundown of the immune system and what macrophages are and their importance. So as I assume everyone here knows, the immune system is responsible for keeping our bodies safe from various infections, whether it be viruses or bacteria. It's also important for preventing cancer, cell proliferation, and just general everyday cleanup in our bodies. Specifically, the innate immune system is the part of the immune system that first responds to any potential threat. And the cell of interest within the innate immune system, excuse me, are macrophages. And so macrophages, again, are one of the first cells to respond, and they release various chemicals that recruit more cells and ultimately lead to inflammation. And I know we hear various different things about inflammation. So it can be a good and a bad thing. It's good in the sense that if you have an infection, you want inflammation to recruit the immune system to kill the virus, kill the bacteria, dispose of it so that your cells aren't getting infected. So in that sense, it's good. However, like many things, if inflammation is um, prolonged or occurs too often, chronically, um, or too extremely, that could also be bad. For example, in the case of sepsis, where you have a really strong immune response that ultimately leads to negative outcomes for the patient, or if you have your immune system responding to the wrong things, like in the case of autoimmunity or allergies. So tying this to the experiment that I got my data from, scientists were observing the impact of a particular receptor called TRG5. They were observing its impact on macrophage activity, more specifically macrophage gene expression in relation to inflammation. So essentially, they had four different experimental groups. They had so they had two cell types. They had wild type macrophages, which had the expected amount of TRG5 receptors, and they also had knockout macrophages, which had were deficient in TRG5 receptors. For each of these cell types, they had two different treatment groups. They had cells that were treated with listeria, which is a bacteria that we usually want our immune system to respond to promptly. And they also had untreated groups. And what they found is that wild type macrophages had a lower immune response than the knockout macrophages. And you might think you want a high immune response because you want to get rid of the bacteria. And it's true, you do want a sufficient immune response. But like I mentioned earlier, too much inflammation can lead to challenges. And that's exactly what they saw with the knockout macrophages, where there was an increased risk of sepsis. So the clinical relevance is that this experiment shows that TRG5, this receptor, is important in immune regulation, to make sure that you have, I guess, checks and balances of sorts when your immune system is responding to something that you wanted to take care of. So now moving on to what I did, I created a feed-forward neural network. Essentially, I took the data which was essentially gene expression data for the different experimental groups, and I created the feed-forward neural network to distinguish between wild type and knockout macrophages based on that gene expression data. Um, I used some of the data to train, I think it was 70%, I want to say, and then 30% was used to test. And I had high accuracy, so that was good to see. So future directions, this could be useful when trying to identify macrophage activity in patients. For instance, if you can use this receptor presence or absence as a biomarker for potential increased risk of sepsis, that could determine which treatments might be best for the patient in order to prevent any adverse effects. and this could potentially prevent sepsis from occurring. So yeah, thank you. And yeah.